Students, this is Dr. Khan, Executive Plastic Surgery. Welcome to another Facebook Live, YouTube Live. So as you will see, this is a very interesting case, and this is what I say is the worst case scenario. She got her implants in 2011, which were saline below the muscle. And then because of her symptoms, she ended up getting an explant in February of 2024, and her symptoms post-op continued, they persisted. And so now, in 2025, August 2025, she comes to me with the complaints, 7 out of 10 of what are symptoms suggestive of what is breast implant illness, and pain on the left side. And she interestingly had her explant done under local. That means she was not even put to sleep. The surgeon gave local and then made a cut, and literally while the patient was fully awake, just like you're at the dentist, pulled the implant out, and the capsule was indeed very much remaining behind. So the goal today was to remove what is the residual capsule below the muscle. Now remember, below the muscle is where the implant was and the capsule is. So the breast tissue above the muscle was not touched. I never touched the breast tissue in any of my explants because I don't need to. That's why I make only the horizontal cut. So as you will see, I cut out the surgical scar at the very much at the bottom, and then this is the residual capsule that indeed clearly was there. And as I cut this open, you will see that glistening white appearance. It was relatively very tough. This was a lower BMI patient, and clearly, as you will see, this is this inflamed tissue that is indeed very much present. And so the entirety of the implant capsule, all of that inflamed tissue was completely removed. I removed some of the tissue at the bottom, and as you can see, this is where it looks abnormal. It is scar tissue, it's pathologic, and I'm going to send it along with the capsule such that the pathologist can roll out the BIALCL CD30 analysis. Now, on the left side, this is the left residual capsule. Again, likewise, as you will see, you have the skin that was removed to help with the contouring. This is the tissue, the soft tissue at the bottom of the capsule. And this is again the entirety of that capsular tissue that was removed right on top of the rib. And as you will see right here, this is this fascia of the serratus anterior, fascia of the pectoralis minor, fascia of the pectoralis major superiorly, the periosteum, perichondrium, all of it was completely removed. You can see, look at this muscle fibers, the fascia that is on the back, all of this completely sincerely removed such that you have only good, healthy, viable tissue. Very tedious surgery. So all the inflamed tissue, capsular tissue around the inflamed tissue around the capsule, completely sincerely removed. The breast tissue again above the muscle, the pectoralis major was not touched. And now I will send this out to pathology. So we will see clearly what the pathology report says in regards to what are the findings or what is within this capsule. And most importantly, we will hear from the patient directly as to how she feels post-op, the first few days, weeks, months later, as to her improvement. We know clearly from the many patients who have had an explant that was done incorrectly under local, and the capsule was left behind, or the silicone spilled in the chest. These patients did not improve completely till they sought out another surgeon, and then the surgeon then removed the residual capsule and inflamed tissue, and only then did the patients bounce back. So it goes on to showing you, do the surgery right, do it complete, do it thoroughly. Yes, it is involved, it is lengthy, it is relatively, I use the word invasive, but this is still outpatient surgery, and in the right trained hands, it absolutely can be done. So this is one aspect of the video. More importantly, the patient will see the chest wall showing complete removal of the capsule plus the implant plus any of the inflamed tissue below the muscle. And if you put both of these two videos together, the patient will have that convincing evidence that the entirety of the capsule was indeed very much removed in the manner as described. This is Dr. Khan, Executive Plastic Surgeon.